Hi everyone, thank you for having me. I had the great pleasure last night of going out to dinner with some of your executives, the executive committee, and David Dawson and I had a conversation, and I asked him, so what brought you to do this kind of work that's different than all the other dentists I know? And he said, well, you know, I used to work in these little white things called teeth, and now I'm changing people's lives. So I guess from a pharmacological point of view, I was thinking, you know, drinking this kind of Kool-Aid causes what we call an irreversible reaction. What that means is someone who thinks that way and tries to help their patients that way can't go back to working on these little white things. You're changing people's lives. And certainly meeting Catherine and Richard and some of the other people in your executive, I really feel that you guys are quite special, and I'm quite honored to actually be speaking to you. So thank you. So what is the evidence for this estrogen dominance in temporomandibular joint problems? First of all, there's more women than men. Again, studies from the U.S. Department of National Institutes of Health have shown that women using supplemental estrogen or oral contraceptives are more likely to get treatment for these conditions. The temporomandibular joint, as when on biopsy, is absolutely receptors for both estrogen and progesterone. And in some, there is one European study where they actually are showing that there are higher estrogen levels in temporomandibular joint women. What does excess estrogen do? Well, it upregulates nerve and muscle function and sensitivity. Women with excess of estrogen can have insomnia, anxiety, water retention, breast tenderness, and fibromyalgia syndrome, and many more. Progesterone downregulates nerve sensitivity, downregulates glutamate excitotoxicity in neurons, downregulates cardiac ischemia in women, and progesterone, when you give to a woman in randomized controlled studies, helps a woman go to sleep who is a candidate for progesterone therapy. Human progesterone is not synthetic progesterone. Human progesterone has never been implicated in any study in any increased risk of cancer. Synthetic hydroxyprogesterone always has been. So human progesterone has very significant benefits to pain and sleep in randomized controlled studies that has not been shown with synthetics. What are the causes of this estrogen problem? Well, drugs, or like oral contraceptives, and naturally what they do is interfere with ovulation so that you will have a natural progesterone depletion. Now I want to talk about obesity, insulin. Elevated glucose and fluxes in blood glucose decrease threshold of pain to maximum pain tolerated. Obesity correlates to fibromyalgia pain. So literally, when in this study, when they looked at different levels of blood sugar and insulin effects, they showed that in different individuals, just on that factor alone, had different pain thresholds and different sensitivities and different abilities to tolerate pain. We know this article published actually in Science 2005 suggested that the first step, not suggested, this is the emerging hypothesis in type 2 diabetes, is that the first step in the initiation of type 2 diabetes is mitochondrial dysfunction in skeletal muscle. Of course, in temporomandibular joint problems, you're always dealing with issues around the muscle or fibromyalgia muscle dysfunction. So the first issue is dysfunction of the mitochondria in type 2 diabetes. Then it proceeds to mitochondrial dysfunction of the beta cells in the pancreas. this Warburg effect is an effect where it's a disruption of, what happens first in mitochondrial dysfunction is as an increased local amount of lactic acid, pyruvic acid. And the Warburg effect describes this actually in cancer cells. Now, this high insulin diabetes, obesity is becoming the #1 risk factor for the origin of cancer, heart disease. So it's Alzheimer's disease, there's linkages, depression, mood disorders, higher rates of mental focus. I mean, a patient with diabetes has multiple other issues besides just the actual blood sugar issues. It really doesn't feel very good in dealing with this